What's up? It's your girl Nurse Shawnee here with a new video today. So today this is a viewer request video. So a viewer requested that I go over what a postpartum admission looks like. And then there was another question from someone else, maybe the same person, that asked about the actual postpartum assessment. So in this video, I'm gonna go over both of those. I'm gonna give y'all what we call in the nursing world a quick and dirty version of the admission process and the assessment. So if you're interested in this video, keep watching. What's up? It's your girl Nurse Shawnee. I am a labor and delivery / postpartum nurse. Right now, I am working as a travel nurse, as a nurse manager, but I have over 14 years of experience in women's and infants. So if we're talking postpartum assessment, I'm your girl. I definitely can give you the quick and dirty rundown of that assessment. So if you don't know what a postpartum nurse is a nurse that takes care of patients in the postpartum period, and this is after a woman has a baby. So the postpartum period is from the time the woman delivers until 6 weeks after the delivery, okay? But in the hospital setting, we are taking care of mom for that first 0 to normally 3 days. Normally by 3 days, mom has gone home unless she has some type of complication. So let's talk a few terms just to get them out of the way. So I told you what postpartum is. As a postpartum nurse, you take care of that patient while they're in the hospital for that very short time after delivery. And then another term that you probably will hear me say a lot is couplet care. So couplet means you're taking care of a mom and a baby together. So they are a couple. So in our world, we call it couplet care. So some hospitals may still function where you have a nurse that only takes care of moms and a nurse that only takes care of babies. But in most hospitals, I want to say nowadays, most hospitals have gone to the couplet care model. I did work at a hospital here in Baltimore that still had the separate mom nurse, baby nurse. So just know those things do exist. All right, so let's talk admission for a postpartum patient. So your patient will have either delivered vaginally or via C-section, because those are the two ways that moms can give birth. So you're either going to be taking care of a patient who has a vaginal delivery, which most often that patient stays in the hospital from 24 to 48 hours. And if your patient has a C-section, most often they're in the hospital for 48 to 72 hours. Again, barring any kind of complications with the delivery, the baby, or anything like that. Okay? So for any admission, as a nurse, you're going to be taking a health history on your patient. You're going to be getting all the details of that delivery. What kind of delivery did mom have? Did she sustain any kind of lacerations or tears to her bottom during delivery? How much blood loss did she have during delivery? Those are all key things that we look at as postpartum nurses. So we're going to get a full health history on the patient and a history of the delivery. So you're going to ask all those questions. Well, actually, when your labor and delivery nurse brings your patient over, they should be giving you the history. But as a prudent nurse, you also want to be making sure that you have checked your patient's chart for orders from the physician, for any kind of history or anything that you need to know that's going to help you to take care of your patient, okay? So that's any kind of patient that you're getting. You want to know the health history. You want to know what kind of medications this patient is currently taking. Most often for our patients in the postpartum arena, the patient is going to be prescribed some type of pain medication. Typically that is Motrin or Tylenol. And for our patients who have had a C-section, sometimes we give them drugs that are a little bit heavier, like oxycodone, Percocet, things of that nature. So you want to review your patient's charts to find out what medications is she prescribed, when is the last time she had that medication, and at what interval should she receive those medications. Always going to follow your doctor's orders. If you have any questions, need clarity on those orders, you're going to refer to the person that wrote the order, the physician, or the midwife, okay? Or sometimes anesthesia, because with our surgical patients, sometimes within the first 24 hours, anesthesia's orders are the ones that we follow. But point being, you want to know what medications your patient has been prescribed. So you're checking your chart for that. Also, during your admission for your postpartum patient, I think it's important to ask your mom, what is her feeding preference? Present day in the hospitals, breast is best. That is typically what we're going to be educating our patients, that breastfeeding is best. However, I personally believe fed is best, okay? So whether or not mom has chosen to breast or bottle feed, you need to know what her feeding preference is. And we don't place judgment. I see this a lot in hospitals where people are forced to breastfeed their babies. And I breastfed one of my children, my second child. My first child, I did not breastfeed because I wasn't really educated about the process. And I was young, so I really wasn't interested in doing it. And no one forced me to do it. Also, nobody really educated me on it. But with my second child, I chose to breastfeed. I educated myself during my pregnancy, and it was something that I wanted to do. So you always want to honor your patient's request, and whatever their preference is, this is what we're going to be educating them on and supporting them in. Sometimes I have seen, and I'm going off on a tangent, but I have seen nurses, lactation consultants, healthcare providers try to force breastfeeding on moms. And let me tell you, breastfeeding is a whole job in itself. Like, I definitely desired to breastfeed my son when I had him, but when I tell you, and he's 21 now, but I still remember how difficult it was for the first 30 days. Every day I wanted to give up because it is a full-time job. Like, you are doing everything for the baby because you're the food source. So you're tired, you're cranky. Breastfeeding is hard. People romanticize breastfeeding. I feel like in TV shows and different baby programs, they make it look like, oh, the baby comes out, you put the baby right on the breast and they breastfeed beautifully. No, that is not what happens in real life. Sometimes it does happen. And babies know how to breastfeed most of the time, but you got to give them, a little bit of direction. And so it can be very challenging for moms to breastfeed. So that was my little soapbox about breastfeeding. I am in support of whatever feeding method a mom chooses to utilize, okay? So you want to know what the feeding preference is so you can support her, okay? So in a nutshell, that is the admission. Health history, medications, birth history, and I think it's important to ask the feeding preference. And also, if a mom has a support person with them, I like to familiarize myself with who that person is, whether it's a family member, sister, mom, auntie, husband, boyfriend, whoever. I like to familiarize myself with that person because, they are part of the process too. And I like to include them in the care because they're at the bedside with the patient when I'm not there. So I want to make sure that we have a rapport as well, okay? So that is an admission for me. And know that every nurse does things a little bit differently. So I'm telling you my experience and what I typically do when I'm working as a postpartum nurse. But every nurse, you may have 5 nurses who do the same specialty, but they may do things a little bit differently. If you're a nursing student watching this video, when you're in nursing school, you are going to learn how to do things safe and efficiently. However, when you become a nurse, you will figure out how to do things that work for you while you're following the policies and protocols of your hospital, okay? All right, so let's get into the assessment. So in the postpartum world, we use an acronym to remember the assessment. So when you think about assessing a patient, you always go head to toe, right? You never go from toe to head. You always start at the top of the body and then you come down. So we do the same thing with our postpartum patients, and we use the acronym BUBBLE, LE, right here. BUBBLE, and then another LE. That is kind of a quick way to remember the steps of your assessment. So I'm gonna go through this quickly. If you want to take notes, feel free to do so. So I learned this when I was in nursing school. I learned this as a nurse when I was a new grad, and I have taught this to my students. Kind of difficult to do that without having a mannequin or a person to do it on, but here we go. So the first B is for breasts. If we think about a person anatomically, the breasts are at the top of the body when we're talking about reproductive organs. So we are assessing the breasts because mom is breastfeeding, and we want to make sure that she can do so without difficulty. Next, we are going to be assessing the uterus. So the uterus obviously is where the baby used to live while the mom was pregnant. So we want to make sure that that uterus is functioning properly and starting to go through the process of going back to pre-pregnancy. After the uterus, we are assessing the bladder. The bladder sits right under the uterus, and we want to make sure that mom is able to urinate and all of those functions are working properly. And then the next B is bowels. So we want to make sure that mom is able to pass gas, she has bowel sounds, she is able to have a bowel movement. Long time ago, women used to have a bowel movement before they left the hospital. That's no longer the case. We definitely want to make sure things are moving in the right direction. So we're assessing that, especially if you have had a C-section, because that can sometimes slow things down in that belly area. So we did BU, BB. So L, this one is probably going to be a word that if you don't work in this postpartum area, you've never heard before. So this is lochia, and I will put it on the screen so that you can reference it. Lochia is actually the bleeding that occurs after delivery. So when a woman is pregnant, obviously she does not have her monthly menses. And so what happens is all of that lining builds up to support the pregnancy. Once the body no longer needs to support the pregnancy, that lining has to shed, and it goes through a process. So we are checking that lochia and or bleeding after delivery. We want to make sure that she's not having too large of an amount. We want to see the color of it. We want to just make sure that things are healing naturally, okay? And this is, again, this is a quick and dirty. This is without me using lots of medical jargon, okay? BUBBLE, another big word is episiotomy. So an episiotomy is a surgical procedure to make the vaginal opening larger so that a baby can come out. We know, or you should know, what anatomy looks like in terms of your vagina. A big-headed baby needs to come out of that small space. And in order to do that, there's a lot of stretching that goes on during a delivery. Sometimes it's a little difficult for the baby to pass through, and we need to make things a little bit easier for mom. And so the doctor will make an incision to enlarge that space, okay? Episiotomies are really something that doctors don't practice a lot from what I have seen. They kind of have stopped doing those. I actually had an episiotomy when I had my daughter. The healing process for that is pretty painful. I will have to say it was quite the experience, okay? And so, nowadays the practices have changed. Evidence-based practice has changed a lot. Physicians and midwives have kind of gotten away from doing that unless it's an emergency. So, like I said before, there's a lot of stretching that occurs, and we are really trying to let things naturally occur as opposed to rushing and, making surgical incisions on people if we don't have to. So sometimes just because of the delivery, mom will sustain some tearing. So as a postpartum nurse, you are checking that area to make sure that it is healing properly, because if the patient has to have an episiotomy and or they have tearing, the doctor is going to repair that with sutures. They're actually going to sew it back up. And so you need to be, one, assessing the area to make sure there's no infection and that everything appears to be healing properly. And you're going to be teaching your patient when she goes home, because remember, you only have your patient in the hospital setting for a few days, but you want to be empowering your patient and educating them so that when they go home, they are able to independently care for themselves. So you're going to be teaching that patient signs of infection and things to look for and how to care for themselves after they go home. We went through the word bubble. So then there's two more letters, L-E, where we're looking at your patient's lower extremities. So when a woman is pregnant, the body builds up with extra fluid, the blood volume increases to support the pregnancy, and sometimes women can develop blood clots in their lower extremities. It is very common, so it is something that we assess for to make sure that that patient doesn't have a blood clot, because if they have a blood clot, even a really small one, it can travel through the blood vessels into the heart and cause that patient to have a pulmonary embolism, which can be fatal sometimes. Oftentimes, pulmonary embolisms are fatal. And so that's one of the things, again, that we're educating our patient on. If they have signs of any kind of hardness, warmth behind their calves, that could be a sign of a blood clot. And so that's something we're assessing for in the hospital and teaching our patients about as they transition to go home from the hospital. And then the last letter, E, is the emotional status, and a lot of people forget this part of the assessment. Listen, having a baby is one of the most amazing times in a woman's life. However, it can also be so very traumatic, so emotionally charged. There's a lot going on. And as a woman, and I'm going to focus on women because we're the ones bearing the children and going through the whole physical process, it's a lot to take on when you are trying to heal yourself from having a baby, taking care of a baby, if you have other children to focus on, if you have your significant other that you have to focus on. It is a lot of stress on you. And women, most of us are natural nurturers. Like, we got to take care of everything. And so what happens is we forget about ourselves. And so women can experience baby blues, which is very normal because of this huge hormone shift. You go from storing all these hormones in your body to support this pregnancy, and then you have your baby, and that hormone shift is very rapid. And so things are kind of wonky and you may not be yourself. So baby blues is very common. but we also have postpartum depression, which oftentimes when you go into the hospital, you are being screened for postpartum depression just to see, if you have any history of mental health issues, whether that be anxiety, depression, PTSD, whatever those things are, because the postpartum period can heighten those things if you already have a history of any kind of mental health disorder, or just because of this amazing but overwhelming time, it can cause women to start to have postpartum depression. And so you want to teach your patient the signs and symptoms of postpartum depression. And especially in our African American community, for whatever reason, mental health is scary for us. Like, we don't like to talk about those things. And so it is really, really, really important that you're educating your patients and helping them identify resources, whether that be their healthcare provider, a mental health provider, just doing that good assessment so that you can give them the support that they need. So that's the whole postpartum assessment. So postpartum nursing used to be my least favorite part of women's and infants nursing. Like, whenever I came in and my assignment was to be on the postpartum unit, I would not be excited about that. But as my career has changed and progressed, I absolutely love being a postpartum nurse because it gives me those opportunities to teach my patients so much. There's so many opportunities for teaching your patient how to take care of the baby, how to take care of themselves, like so many opportunities. And I actually love it. Like, I love helping moms start to breastfeed. I just love everything about postpartum nursing. I used to love being a labor and delivery nurse, but now not so much. But postpartum nursing, I definitely, value spending that time with my patient. With nursing, nowadays, people are so much more sick, and the volume of patients is a lot. We don't always get those opportunities to spend a lot of time with our patients, but I find in the postpartum setting, I can spend just a little bit more time with my patients. And it gives me a sense of satisfaction as a nurse to be able to feel like I've done something to help my patients. And so, always go from that perspective. Yes, we got a lot of charting to do. Yes, we have a lot of patients to take care of, but really, our patients need us to be advocates for them and to educate them about their needs, even the things that they don't even know that they need. Think about your patient's needs and think about, the joy that you may be able to bring to another person's life. So this video was longer than I anticipated it to be, but I hope that it was helpful. I hope it answered your question as to what the admission process looks like for a postpartum nurse and what the assessment looks like during the postpartum period. I thank you guys for watching. Like, share, and subscribe. If you have any more questions for Ask Nurse Shani, leave them in the comment section. I'm always, looking for more content that is very valuable to bring to the nursing community here. Like, share, subscribe, and I will see y'all in the next video. Peace out.